Noon. I was going to say good morning, but I guess it's officially noon, so I need to switch gears here. So welcome everyone. Thank you for attending today's webinar. We've got a great discussion ahead of us. My name is Amber Willett, 2018 Carlson MBA Millie alum. I've been on the affiliate board since I graduated. So we lead these webinar series to share business stories, share business challenges, and learn from each other because, we see a lot of highlights on social media. So let's share the hard stuff too and how we got through it and what we can learn from it and share our story. So that's the goal of today's webinar. I am the host and I am thrilled to introduce our guest today, Peter Bornstein, MD, MBA, Millie affiliate physician, and former managing partner at St. Paul Infectious Disease Associates. So welcome, Peter. Thrilled to have you on today.
Hi, Amber. Thanks for inviting me. Happy to join you.
So yeah, should be a great chat. And for all that are attending, just a few housekeeping notes. Feel free to throw any questions in chat and we'll try to get to them at the end of the conversation. And we will also be recording this and posting on our Millie YouTube. So you can search up the Millie YouTube. If you aren't subscribed already, subscribe. We got lots of great stuff on there. All right, so let's jump in. So let's kick it off with some background. So Peter, can you give us a quick overview of your career journey and how you found yourself in a leadership role?
Yeah, thank you for asking. So I'm a graduate of Rush Medical College in Chicago back in 1987. I know that's probably before some of you were born, but and then I before that I was in college at Johns Hopkins. I was a natural sciences major and then a medical doctor, and I did a internal medicine pediatrics residency at Henry Ford Hospital in Detroit, and later did an infectious disease fellowship at Northwestern University in Chicago, which I finished in 1993. And that year I joined St. Paul Infectious Disease Associates, a private practice in St. Paul. I was the fourth doctor to join the group. Had a good time in my discipline, infectious disease. We do a lot of leadership roles, infection control. I was chief of staff at St. John's Hospital in Maplewood. So I had some leadership roles, but I was getting a little antsy practicing medicine in the mid 2000s. And so I was looking for a pivot possibly. And so I enrolled at Carlson in the part-time MBA program starting in 2008 and graduated in 2013. During that time, our managing partner at the time, unfortunately, developed a very severe cancer and had to leave unexpectedly. And the other partners looked around and said, "Well, Peter, you have leadership experience and you're in business school, so will you be the managing partner?" So I accepted that role and became the managing partner around 2009, 2010. So had only a few semesters under my belt at Carlson at that point. But it was a tumultuous time because we had a lot, there's always change all the time. People always look back at the golden years, but the golden years, there are no golden years. Every year, the year you're living in now, 20 years from now, you're going to think this is the golden year. So there's always change. So there's a lot of change happening at that time, back about 15 years ago.
Yeah, I feel like that's always so interesting, our career path. I feel like when you start your career, when you're first in university, however you start, you kind of envision this like straight kind of path up, but it's usually a lot of zigs and zags, and sometimes you end up where you didn't expect,
Yep.
and just get, you kind of step up and say yes, right? Which sounds like what you did.
Right.
So you're in the independent practice. So can you give us some background? What was the structure of your independent practice before the
So
transition?
yeah, so we were a traditional private practice, group practice, single specialty. So we were just infectious disease. We did share some overhead with internal medicine practice, a nephrology, kidney specialty practice, and a cardiology practice. And between the time I joined in 1993 and to about 2010, the cardiologist practice left, joined St. Paul Heart Clinic, and another group in Minneapolis, and then the internal medicine practice was acquired by Allina, and so it was just in the us and the kidney specialists sharing overhead, and then they decided to go off and use a different group. So we were on our own. We had a clinic in Little Canada, and then we had we practiced hospital rounds, which is the bulk of our work at hospitals, at United Hospital in St. Paul, part of Allina, and then what at that time was Health East. All the Health East hospitals, they had 4 hospitals at the time: Bethesda, St. John's, St. Joe's, and Woodwinds. And so we provided infectious disease care, but we were a private practice. So we billed insurance, we had to collect from insurance, we had to collect from patients, co-pays, and we had all the headaches associated with trying to manage cash flow. And it was getting very difficult to do that. You know, nowadays, I think most physicians are not in private practice anymore, which was quite different from when I started back in the 90s. You know, the vast majority of physicians were in private practice. So you could talk about the decay of private practice in the United States, but we were certainly part of that.
Absolutely. I think that's one shift that has had ripple effects throughout the healthcare ecosystem. Absolutely. Could be its own webinar. So there was a decision made to restructure. What were the driving forces behind that decision? Like market conditions, operational challenges? Can you walk us through that?
Kind of all of the above. I mean, it all comes down to money, unfortunately, like everything else, and your revenues. And I always say, if you can't make enough money to hire a new person, you can't exist. And that was what was going on, is that we had declining net revenues because it was insurance reimbursement was less. We were staring down the gun of electronic health records and the cost of implementing those. And we decided we really could not be a full standalone independent practice. And the senior partners and I had gone to the more junior partners and said, you know, we should really sell the practice. And one of the healthcare organizations we worked with offered to buy us, and they said they saw the value that we had. But the junior doctor said, no, we don't want to be sold. We want to stay independent. And so we worked with a healthcare consultant, Joe White, Clifton Larson Allen. I think he's on faculty at St. Thomas in their business school. But at the time he was advising us, and he said, you know what would really work? No one's done it before, but if you could have joint professional service agreements, one with Health East and one with Allina, you could probably stay quasi-independent, So that's what we did. And it took me about 1.5 years to negotiate simultaneous professional service agreements with both organizations. At one point, I had to bring them into the same conference room at the boardroom at Bethesda to say, you know, this is our situation. We need your help. And fortunately, they understood the value of our specialty and how important it was to maintain a healthy practice. I think at the time, Allina was not interested in acquiring our service line. It's a funny specialty that we're in. We're not really we don't bring a lot of business to the hospitals like a orthopedic surgeon would, or an oncologist or cardiologist. And, you know, that's why they build all those big centers for those specialties. But we're indispensable for the quality of the patients, especially surgical and oncology patients not getting infections or treating the complicated infections that occur, you know, infrequently, fortunately, but when they happen, they're devastatingly awful for the patient and devastatingly expensive. So that was the thing that they recognized. And I was telling Amber that, you know, the key insight that I got from my experience at Carlson, I think from strategic management standpoint, was truly recognizing who our customer is. And in healthcare, it's kind of funny because you bill insurance, but they're not your customers. And you try and acquire patients, but, you know, not all of us are seeking patients. We've never advertised to get patients. So our customer was not the insurance company, and our customer was not the patients. Our customer was a hospital. The hospitals were the entity that really valued us. And so we negotiated with the hospitals, and they signed this agreement to pay us to see patients at their facility. So basically, we're contract employees for the healthcare systems. And if you come to our infectious disease clinic at Allina, it'll say Allina Infectious Disease Clinic, but it's staffed by St. Paul Infectious Disease Associates. And similarly, at the M Health Fairview Infectious Disease Clinic in Maplewood, it's our group that does that. So we're contract employees for these two big companies, and we also have some management agreements with them for some non-patient care activities. And we still retain the right to work outside of the service area, which is primarily the metropolitan area. So we could still do independent practice elsewhere, but it really helped our cash flow to be able to sign those agreements with the healthcare organizations. Because, when Medicare, you know how the government is. I mean, they're not always running, or there's a stop in payments from Medicare because the government's halt or Congress couldn't agree on something. For a small business like us, if we stop getting Medicare payments, we still need to make a payroll. But for a larger corporate entity like a healthcare system, if Medicare doesn't pay them for a month or two, they have reserves that they can fall back on and manage their cash flow. So working within a large system, that really helped us. And then also we got to use their electronic health records, so we didn't have to invest millions of dollars in that sort of thing. So it really worked out well for us to sign these agreements. And so that was about 13, 14 years ago that we finalized it. It took about 18 months to finish the process, 18 months to 2 years to get all the agreements and going back and forth with the lawyers and making sure, all the I's were dotted and T's were crossed. But it's been pretty good for us the last 13, 14 years. Whether it'll last another 13 or 14 years, I don't know, but it's been good so far.
That's really interesting. I think there's a few really key points in there. Understanding your niche. There's this human desire to benchmark and compare, like, okay, what worked for that organization? They look kind of similar to us. What worked for them? While that's helpful, understanding how your niche, your specific niche is different. Again, being, a small business in infectious disease is a special kind of niche. And as you called out, it doesn't have, the same positioning as ortho or some of those other big, more public entities. So I just think that's so important. And then really understanding who your customer is. And I think that sometimes you jump to a conclusion, and to your point, thinking about, okay, well, who pays? It's not quite as simple as that. Yeah, who are you serving? Who do you exist to serve? Who recognizes your value? Who are you selling to? And that's not always obvious, and you have to prioritize also if you've got multiple customers, and then across the organization being clear about who your primary customer is, so that the rest of the business operations can kind of rally around that.
Right.
I think those are some really key points that you hit on that I think apply, universal, even outside of healthcare.
Yeah, it really took a while to figure out who our customer was, because it wasn't, especially after, with private practice failing. And you see this now, I think, with other healthcare setups like direct care. Some of the primary care offices are moving to this direct care, which is, the patients will pay us and we don't care about insurance, and you'll just pay us a subscription, for example. Or concierge medicine, which is not exactly the same, but somewhat similar. It's a subscription model. And part of that reflects that the revenues that you get from Medicaid, Medicare, and even traditional third-party insurers often is not enough to sustain an independent practice, especially one that's not owned by a large healthcare system. Large healthcare systems, especially in Minnesota, they have the advantage of being nonprofits, and so they can retain a lot of cash, and they can solicit donations for their foundations. And but a small business owner, you can't typically do that, so you have to find some other way to make the money flow work.
Yeah, creativity at its best, right?
Yeah.
And in general, change, while necessary and obligatory, does often meet resistance. Did you face any pushback from the team or external partners? How did you handle that?
Yeah, great question. So, in the process of this happening, part of the necessity was that we were losing some doctors and having to recruit like crazy to get new specialists. And a couple of the people who left, they said, well, it's not you, it's me. My spouse doesn't like it in Minnesota anymore, and we want to go somewhere else. And I'm like, okay, fine, I can't make you stay. But so that was part of it. But again, also we also had some junior partners like, no, we really want to stay independent. We don't want to work for a large entity. One of them had come from a large entity I'm not going to name, but they didn't like working there. And so there was really a desire amongst those who stayed to really try and make it work. The hard part was that we gave up our independence, especially our office staff. So because we had independent clinic, we got rid of that, and we merged into the clinics owned by Allina and Health East. And so we couldn't keep all of our staff. Allina didn't want to hire anybody that we were employing. Health East did offer to hire a couple of the staff, and so we were able to bring 3 of them over. Unfortunately, our administrator, she was ready to semi-retire. Let's put it that way. She was ready to cut back. So she still stayed managing us at that time, because we still had because of the professional service agreement that only brought in money, but internally we still had to manage our HR stuff, our hiring, our benefits, our salary, managing the calendar, all those things. And that takes resources. And so we did have a manager to do all that, and the HR for the physicians. And we did keep a couple of very part-time clerical people to manage the incoming faxes, because we had to retain medical records for 10 years, which we don't have anymore. But and I told the partners, I said, this may fall apart. And so I want to stay able to reboot or respin up St. Paul Infectious Disease Associates, we called SPIDA. I wanted to be able to respin SPIDA up if things fell apart after a year or two. And so I felt it was really important. We still kept an independent office I called our clubhouse, which was basically just a conference room and some file cabinets and a computer. And we kept our corporate entity. Of course, we didn't sunset our corporation. So now 13 years later, is it as important? No, the model seems to be working, but we really don't. We ended up now we have a management company, Health Management Resources, that helps us with some of our back office HR stuff, licensing, credentialing, insurance, payroll, that sort of thing. But we're pretty lean. I mean, fortunately, most of the expenses are borne by the healthcare organizations. And so our overhead actually is pretty low, but we do have to negotiate what they pay us. That's the other part of it. So instead of negotiating with insurance companies and accepting or rejecting, we have major negotiations now with our 2 health system partners to make sure that we are compensated fairly and sustainably. And so far we are, because I'm pleased that we've been able to hire people over the last few years. And as I said, when I started, I said, if you can't hire someone for your business when you need to, your business is not going to survive. I mean, because you can't work forever, and people are going to get sick or something's going to happen. So you have to be able to make enough. I could work for $1 a year, but I can't hire someone for $1 a year. So that's the issue.
Yeah, you can't run on a skeleton crew very long without massive quality and survival impacts. And I think you hit on some key points for change too. One is like acknowledging the risks, like just being open about that. Like, let's, amongst ourselves, let's not sugarcoat it. Let's talk, be transparent. Let's talk about what we're up against. And then let's figure out, do we have any fallbacks? What can we create as a net for ourselves? And communicating that and acknowledging that there's going to be competing viewpoints, but we're all going into it with eyes wide open. We're being transparent, we're being clear. And I think that builds that trust that I feel like is absolutely critical. If you've got a lot of change going on and there isn't trust amongst the team, it just falls apart.
Yeah. So one of the great classes I took at Carlson was the managing groups, and setting up, as you said, that kind of safe, trusting space that, hey, we're going to talk. Nothing's off the table here. This is a safe space. But when we're done talking, it just stays in this space. And, you don't take it out to other people and tell them about it. This is for us, but we are a strong group, and the group comes first. And that worked out fairly well. That was a great class.
Oh, yeah, absolutely. That's such a great takeaway and like tactical knowledge to take out of your MBA for sure. Because yeah,
Yep.
nothing is going to kill any innovation or change or product like a quiet, festering pocket of silent resistance
Yeah,
of
no.
folks who are nodding in the meeting, but then not fully on board. So having that space of like, okay, we're laying it all out here. We're getting aligned here. There's trust to do that. Is the key. And of course, it's never perfect, it's never flawless. And I'm sure there were things that did pop up. Were there any unexpected challenges or things that surprised you as you went down that path?
Yeah, I think the thing that surprised me was just how long it took to get this all done. I thought maybe, with 6 months, 8 months, something like that. But the back and forthing with the lawyers, the back and forthing with a large organization like Allina, or like Healthy, not Healthy so much, but Allina, but certainly now with Fairview, all the multiple layers of people that had to sign off on this. I mean, it had to go all the way up to, either the CEO or near the CEO level to get approval for it. It all takes time, just took so much time. And we were running, out of time. I mean, as far as our revenues go, because we couldn't go into the new model until all the paperwork was signed. In the meantime, we were still shedding money. And I told one of our associates at the time, I said, you're going to be the best compensated person here, because the partners aren't making any money. We made some, but the associates who we had to bring in on a salary were getting paid better than the partners, the owners. Because if anyone who owns a business knows, the first thing you got to do is make payroll, and then the owners get what's left, and there was less and less left for the owners. So that the signing of the paperwork happened just in time. So otherwise we were there. And I saw this happen with other specialties in the Twin Cities. I saw other specialty groups that basically collapsed and ended up being bought by the large healthcare organizations. So there aren't a lot of hospital-based, let me put it this way, there aren't a lot of specialties left whose work is primarily in the hospital who are not owned by the hospital. So, our group is one, and it's just in St. Paul. All the other infectious disease specialists in Minneapolis now have been bought by a large organization, other than Intermed at Southdale, which is similar to us in that they managed to sign these contracts. But the other ones did not, and other specialties too as well. Neurology, I think the only standalone clinic now, Noran Neurologic Clinic, has a lot of outpatient stuff that they're able to do. But yeah, it's very hard to have a practice that sees patients, derives revenue primarily from hospital setting, and be independent still.
Yeah, so I think absolutely acknowledging timeframes could shift and not waiting until you're in dire straits to start the change, right? Being a little proactive.
Yeah,
I've made it.
I wish I had started the process earlier, but it also takes time to set the platform on fire and have everybody know that it is a burning platform that needs to be put out. So not everyone smells the smoke or sees the flames.
Yeah, that's a great analogy. Yeah, so what was the outcome? Did you set out what you achieved to do?
We did, yeah. It turned out very well for us. If the metric that you use, there's different ways to compare it, but one is we can hire, and we've not had any problem hiring, given the constraints of just manpower in general. But also our compensation, our total compensation, is at the 50th percentile or maybe slightly above compared to other people in the country. So we're not rich by doctor standards. We make a nice living, I won't deny that, but infectious disease, if you look at all the different specialties, infectious disease is usually at the bottom or near the bottom of total compensation compared to other specialties. So no one goes into infectious disease to be wealthy. In fact, you could argue that it was a mistake to go into infectious disease. These days, someone coming out of training with just internal medicine, not doing a specialty fellowship, makes more money than infectious disease specialists do. So nobody in my specialty is doing it for the money anyway, compared to other specialties. But we do enjoy the work and enjoy what we can contribute to for our patients and for the healthcare system. So I'd say it was a success for sure.
And certainly an absolutely critical element of healthcare. I know we were talking earlier about the role of infectious disease during the COVID era. It could be a whole nother webinar series.
Yeah.
But yeah, it's certainly very critical to keep that going, keep that healthy function alive. And sounds like you learned a lot throughout that process. I'm sure your team did. So what advice do you have for other healthcare leaders or business leaders navigating complex organizational changes?
Yeah, one thing that's really important, I think, is to have an anchoring philosophy or some kind of anchor that you can work off of. I mean, for us, it was patients first, patient care. That was the anchor that helped us with the healthcare systems negotiating, because they knew that we were interested in safety for the patients and that we provided a good product. And being able to have that vision, of what you want, having some patience, because it can take time and there will be bumps in the road, and trying and educating your staff about how the business works, because I think a lot of people kind of hone in on their own little areas. Like, I just want to see patients. I don't want to, do anything else, or I don't care how anything else works. And there's always going to be those people. But in terms of getting the organization to steer it, it's best to have open communications and try and let people understand, okay, these are our organizational challenges. This is what we're facing. This is the outcome that we hope to get when we implement these changes. So that kind of clear communication about, what your goal is, how you're going to get to that goal, was really helpful for us.
Yeah, I think that's so critical, no matter what function you're in, is figuring out what does the rest of the organization need to know about what we're doing, to understand the state of the organization. Like, what level of detail do they need? And that's going to vary depending on the size of your organization and the, the maturity level. But I think that goes a long way to rolling forward together as one, when you've got lots of different perspectives on the work.
Yep.
Wonderful. Well, we've got 3 minutes left. I did want to save a few minutes for questions. So I'm going to ask Peter one more question, but feel free to throw questions into the chat now. We'll try to get to as many as we can in the last 90 seconds we have here. But yeah, wanted to ask, so there's tons of change in healthcare, more change to come, I'm sure. What skills or mindsets do you think are critical for leaders to develop?
Yeah. Again, how does the change affect the goals of the organization? And, think about changes that are coming. I think probably the biggest one is AI. And how does implementation of artificial intelligence help you as the employee, as the provider, whatever your role happens to be in the company? Is it helpful for the customer, your patient, whoever is it going to help them, or is it going to help you help them? And if it doesn't, then that's a good time to push back and say, okay, I understand we want to do this AI, or we want to do this electronic health record, or we want to do something else. We talked a little bit about work from home versus work from the office. Is all this sort of thing going to help me provide the best service for the organization, for our customers? And that's kind of the lens I hope everyone looks through when they're looking at whatever change is coming.
Yeah, I think that's a great perspective. What's coming down the pipeline? How can I be prepared? How can I prepare my team? And really then also not being afraid to ask the hard question, not being able to challenge, assumptions, even long-held assumptions, I think are critical to continuing innovate, continuing to grow, continuing to thrive and not stagnant, especially like the older the organization, the more true that can often be.
Yeah, I think this is an exciting time, and I think a lot of changes are coming, and those who are willing to embrace or look at the changes or understand how it's going to help themselves or the organization are going to thrive. Those whose only answer is resistance are going to either be unhappy or leave or be asked to leave. So, it's okay to push back a little bit, but at the end of the day, you do have to recognize that change is always coming, and it will continue to come, and so you have to be prepared for that.
Absolutely. And there's nowhere to go to hide from change.
No.
If you don't like the direction your organization is going, that's one thing. But if you don't want to deal with AI, it might be a hard rest of your career if you've got more than, a couple weeks left. So yeah, I think developing that growth abundance mindset, as I always see on, LinkedIn, certainly helps with that. And yeah, lots of great insights today here, Peter. Really appreciate you walking us through that. Such transparent detail. Congratulations on all your success launching this. A long road.
Long road, and I am semi-retired now, so I'm not
You've earned it.
Every day, but I still get my finger in and enjoy it.
Wonderful. Well, thank you so much for your time today. Yeah, I think Peter and I are both on LinkedIn, so feel free to follow us or, DM if you have any follow-up questions. We are at time, but again, thank you everyone so much for taking a half an hour out of your day listening on this discussion. And thank you so much, Peter, for taking the time to share your perspective.